Hello friends, welcome to a new lecture today. In this class, I would like to explain about the premature rupture of membranes. In the last class, I have explained about the premature rupture of membranes. Risk factors, some of the risk factors I have explained. So, what are the risk factors of premature rupture of membranes? Number 1, over-distension of the uterus. Whenever there is over-distension of the uterus, either due to polyhydramnios or macrosomia or multifetal pregnancy, all these will increase the intrauterine pressure, thus causing membrane rupture. Whereas urogenital infections, any urogenital infections may be due to chlamydia trachomatis, trichomonas vaginalis, bacterial vaginosis, or group B beta hemolytic streptococci, or Neisseria gonorrhea. All these will also cause imbalance between matrix metalloproteinases and tissue inhibitors of metalloproteinases. So all these will cause premature rupture of membranes. There are also some connective tissue disorders. In these connective tissue disorders, there is inherent defect in collagen synthesis, and as a result, there is defect in collagen synthesis. Here you see premature rupture of membranes, and there are also other risk factors which are seen during in pre-pregnancy stage and in pregnancy stage, and also other risk factors. Just a minute. There are some other risk factors for premature rupture of membranes, like for example pre-pregnancy risk factors. So these pre-pregnancy risk factors include presence of lower socioeconomic status or low basal metabolic index, body mass index, or if there is previous premature rupture of membranes, or it can be cervical conization. Okay, in all these cases there is a chance of again premature rupture of membranes. Why cervical conization? Whenever there is cervical conization, a part of the this part of the cervix is removed. When this part of the cervix is removed, there is decreased anchorage, and as a result there is an increased chance of premature rupture of membranes. This is one thing which is important to remember. And there are also some risk factors during pregnancy. The risk factors during pregnancy include: 1, whenever there is bleeding in first or second trimester. Okay, whenever there is bleeding in first or second trimester, or if the mother smokes, that is maternal smoking, or nutritional deficiencies, or preterm labor. Even in preterm labor there should be premature rupture of membranes, and cervical encirclage. So these are the different conditions which can cause premature rupture of membranes. Now let us learn about the complications of premature rupture of membranes. Okay, what are the complications of premature rupture of membranes? Just a minute, let me draw a diagram. So now, what is happening due to premature rupture of membranes? Whenever there is rupture of membranes, the amniotic fluid which is there, that amniotic fluid is gushing out of the vagina, right? So you see the amniotic fluid which is gushing out of the vagina. So now, what are the main maternal complications? First, there are maternal complications and the other fetal complications. First, let us learn about the maternal complications. The maternal complications are: 1, because of the rupture of membranes, pre-labor rupture of membranes. 1, there can be a chance of infection which is reaching the genital tract. So because of this, there can be chorioamnionitis, that is infection of the chorion and also amnion. And sometimes it can also cause, because of the infection, it can also cause puerperal endometritis, where there is infection of endometrium. This can also occur, and these can finally lead to maternal sepsis. Okay, then because the whole water, the amniotic fluid which is there, that is discharged out, that has gushed out. So because of that, the placenta which is there, this can undergo placental abruption, or it can also cause retained placenta. So these are the main complications, maternal complications of pre-labor rupture of membranes. Now, what are the fetal complications of pre-labor rupture of membranes? So just a minute, I'll just draw a diagram. Now, let us learn about the fetal complications of pre-labor rupture of membranes. In fetal complications, as I have said, there can be infection. Because of the rupture of membranes, there can be infection which can reach the amniotic sac, because here first there is rupture of membranes right now. Because of the rupture of membranes, there can be the infection which can reach the fetus. And this infection can cause fetal infections. There can be microorganisms which can reach the fetus. So this leads to fetal infection. In the fetal infection, there can be pneumonia, there can be septicemia, or there can be perinatal death also. Okay, so these are the different fetal infections which are seen. And then because the cord which is there, because there is no amniotic fluid, there is no cord which separates the fetus and the there is no amniotic fluid which separates the fetus and the cord in a better way. So as a result, as there is a pre-labor rupture of the membranes, there is a chance of cord prolapse also. Let's think that if this is the uterus and this is the baby. Okay, now whenever there is no already the membranes are ruptured, then there is a chance that this uterine placenta which is there, that may prolapse out. Okay, so there can be, what is this called? This is called as cord prolapse. Cord prolapse is one of the complications of premature rupture of membranes. Now, this premature rupture of membranes, the other complications of premature rupture of membranes can be are dependent based on the time of premature rupture of membranes. For example, if there is premature rupture of membranes in the preterm, for example, if there is preterm premature rupture of membranes, then what happens? The baby which is there, complications. So the baby, because here now the amniotic fluid is lost. So because of the amniotic fluid, loss of amniotic fluid, the baby which is there, that is a premature baby. Now the baby is very small, right? The baby is very small and it is a premature baby. All the organ systems are not developed in this baby. So there are some complications of this premature preterm premature rupture of membranes. One, in the baby, if you see, there is prematurity. Now all the complications of prematurity are seen in this preterm rupture of membranes. So now let us learn what are the complications of prematurity. Because there is prematurity, the lungs which are there, they are not the lungs are not mature, that is, there is no surfactant production. Because there is no surfactant production, this can cause respiratory distress syndrome. That is one thing which you have to know, respiratory distress syndrome. Why is this there? This is because there is no lung maturation. So as a result, there is no surfactant in prematurity. As a result, there is respiratory distress syndrome. And the next thing is, there is the skull and the brain are very delicate. Because they are all the connections, they are not formed, they did not mature. So as a result, the skull and the brain are delicate. So as a result, it can cause intraventricular hemorrhage. Okay, and this prematurity also leads to where here the gut is not matured. Is not matured enough to hold the bacterial organisms, and thus it can cause necrotizing enterocolitis. Okay, so these are the different complications of preterm premature rupture of membranes. The main reason of this complications are prematurity. Now, what are the complications of second trimester? I'll write it in my next page. Now, what are the complications of second trimester premature rupture of membranes? What happens in second trimester premature rupture of membranes? Just think that this is the uterus now. Now the baby is a little well developed, right? A little developed when compared to the previous one. But if you see in the second trimester, there are two important things. One which is important is here, because the baby is a little bigger. Okay, now in the second trimester, the baby is a little bigger. Once all the amniotic fluid is drained, then what happens is the uterus becomes smaller than the gestational age, and the fetus which is there, so this uterus may compress the fetus. Okay, so now there is no room for amniotic, there is no amniotic fluid, and as a result there is no room for the fetus to flow freely, and as a result this fetal limbs and fetal body, these are compressed against the uterus. Now uterus is compressing the fetus now. So because the uterus is compressing the fetus, this will cause fetal anomalies. Mostly it causes limb deformities. Okay, that is one thing which is important. Okay, and one more thing is because normally amniotic fluid is required for lung formation, right? But here it is second trimester, the baby is a little smaller, and the lungs are not still formed here. Lungs are not formed here, and for lungs formation we need amniotic fluid, and as a result here there is pulmonary hypoplasia. Okay, so this is the second, these are the risk factors of second term premature rupture of membranes. Here in preterm premature rupture of membranes, already the fetus is well formed, but the main problem is prematurity. All these structures are formed, but here in lungs are formed, but there is no surfactant here. Here the skull and brain are formed, but they are not formed, they are not matured. Mainly the problem is prematurity. Here in second trimester the problem is inherent formation defect, where lungs are not formed, so that can cause hypoplasia, pulmonary hypoplasia. So these are complications of second trimester premature rupture of membranes. Now what about the long-term sequelae? Let us learn the long-term sequelae of premature rupture of membranes. The long-term sequelae of premature rupture of membranes include: one, there is whenever there is periventricular hemorrhages, it can cause cerebral palsy. Because of hypoxia, there are many reasons for cerebral palsy, in fact prematurity. Okay, then it can also cause mental retardation, and then it can also cause visual and hearing defects. Okay, and it can also cause chronic lung diseases. So these are the long-term sequelae of premature rupture of membranes. So these are about the complications of premature rupture of membranes. So thank you guys for watching my lecture. In my next class I will explain about the clinical features of premature rupture of membranes. So thank you for watching my lecture. Thank you.